Hi, this is Dr. John Grazel, and this is the second part of our synopsis of the discussion of health and international development. The first part we discussed just very, very quickly a small number of the tremendous successes in health and the effect they've had in connection with international development. But this half is to look at the other side, which isn't as easy emotionally, because one doesn't particularly want to come out negative in what has been, in many cases, such a successful field. But this is another side of the equation. Health consumes enormous resources in every country, our own country, enormous resources in underdeveloped countries. And it's not only governmental resources, but the resources of people themselves. That we find out that the poorest people spend a significant amount of their income on medication, both traditional and modern. So health is a major cause. We've had tremendous successes, as we discussed, and in reductions of maternal death and child mortality. But in fact, we still find today inequalities. Something like 1 in 7 women will die in Niger in relation to childbirth, compared to something like 1 in 40,000 in Ireland. We've seen how successes like what was called oral rehydration therapy, very simple ways of treating diarrhea, had major effects on the reduction of child mortality, and yet diarrhea is still the major killer of children in underdeveloped countries. We're seeing the actual return of diseases such as tuberculosis and sleeping sickness, diseases that were wiped out or at least greatly forced to retreat through public health actions in the 19th century as well as the 20th century, and now are emerging again in even more virulent fashions. Now, another example of this good twin, bad twin is we discussed how, as horrible as it is and the terrible consequences that are still going on in terms of HIV/AIDS, education has proven to be one of the most effective ways of actually dealing with it. And by education, meaning not use of condoms, understanding the importance of testing, how communities can help members who have AIDS, etc. But now here's the other half. The amount of money we're spending for HIV/AIDS is just increasing disproportionately to other more lethal diseases. Spending on child and maternal health care, spending on primary health care is going down, even though those are far more major killers in many cases than HIV/AIDS. Funding for education for HIV/AIDS is going down in favor of funding for very expensive drugs and treatment for HIV/AIDS. So we're seeing again how we're allowing our investments not only in amounts of money, but in direction and actually targets beginning to distort us from investing where there really is the most return for our money, the most need, the most success. What we're seeing is that somehow many of the successes seem to be retreating, and actually new ones coming up. We are finding that a new epidemic in diabetes is becoming a worldwide epidemic that's threatening everyone across social classes and across nations. So we have to ask ourselves, what's gone wrong? If we built up so much capacity, so much knowledge, so much experience, why do we seem to be going backward? And I'm going to discuss what I think are some of the reasons. Basically, first is that we have a focus basically on disease and not on health. We have a focus on treatment and not on prevention. And we have a focus on technology and drugs and not on behavior change and education. This has increased over the last several decades, and it is a direct extension of what is a Western and particularly an American approach to health, one which has not served our own country well and is not serving the rest of the world well. Coupled with this is a tendency to be fascinated by going after big payoffs like eradicating polio rather than going for what look like less romantic things like making sure that the sewers don't leak. You get a lot more hit empathy in terms of empathy and sympathy, which we've discussed how important that is for human motivation. When you see a sick child who then looks healthy, than when you see a dirty sewer and then you see no just a clean street. So all of this is combining to actually distort the nature of our investments in health. We go into single focused, high profile investments. Hospitals that later don't have the money to actually run themselves. Bed nets for malaria in countries where people don't have beds. And that's actually a quote from the Minister of Health of the Congo, who to certain people for the Center for Disease Control. And we see basically an ever increasing belief that medicine should follow an individual orientation and a profit motive, market driven way of both delivery rather than be seen as a public good. And this is now distorting the entire way we invest in medicine and is actually causing us to lose the momentum we actually had in making those type of public health investments that really made the difference. Beyond that, we have several interesting things. Because we've actually increased the capacities across the world in health, we're finding, one, a brain drain so that doctors and nurses from developing countries come to developed countries. We're finding that even in developing countries, we're increasing the quality of services for elite groups in health, but not the equity in terms of availability for all people. And then we have another very interesting phenomenon that's occurring, which is because the profit motive is involved, we're getting some pushback on what were the tremendous advances we made on the international cooperation of health. And here's an interesting example. In the last scare about avian flu and the possibility of a worldwide epidemic, the nation of Indonesia at one point actually expressed the doctrine of viral sovereignty, the idea that it would not automatically allow the World Health Organization and others to come in and investigate what was the viral situation in terms of Indonesia and take out the viruses and do with it what they wished. And while that may seem bizarre, it's not bizarre from a perspective of people who say the second half of that equation is some drug company then patents it and then says that you can't have the vaccine unless you pay them, and you have to pay them usually a fee that makes it at best challenging, if not impossible, to actually treat your entire population. So what we're looking at is that those basic foundational principles of development, systematic cooperation in a sustainable and economic fashion, which were the key to the true achievements of health and development, have now sort of retreated as they're being replaced precisely by more idiosyncratic, single-focused, private sector-oriented, elite or favored population, favored disease, favored purpose determination of where health investments go. And this is a challenge for us and one we really have to look closely at because it gets to the heart of our health, not only as individuals, but as communities and as a society. So there's no avoiding it. In the end, health is about caring. Health is about healing. Health is about service to others. And the market approach to health may well not be the best way of actually achieving the objectives most of us want.